Dr. Eric Hefferon here with another Friday tip. This week we're talking about shin splints. I know a lot of friends and patients and clients that suffer from shin splints. So we're going to talk quickly about ways that people get it and several ways to improve your symptoms. One, I see improper footwear quite a bit. So if you're out running and you've got an old pair of shoes, might be time to upgrade. Getting a pair of shoes that accommodate your foot structure is really important. I do a lot of CrossFit, so I know that if you're in an endurance class or the workout requires a lot of running, I think it's really important to actually have a running shoe. CrossFit shoes are great for lifting, but not necessarily for a lot of mileage. So if you're going to go to CrossFit, you're going to do an endurance class, I would bring a pair of good running shoes for your foot. And then lastly, or a couple other things, is that increasing your running distance too fast, too soon, can also cause some tenderness and pain in that front of your lower leg. So make sure that you're gradually or incrementally loading your system by gradually increasing your mileage each week. So follow a kind of a good running program, and there's plenty out there. And lastly, I think making sure that you have good flexibility and strength in the whole lower quarter of that leg so that the front of the shin isn't getting beat up. Now, if you're suffering from shin splints, I think there's several things that we gotta improve. And so using different mobilization tools like a ball or a mobility band or a TheraStick is important. I always like to use heat first. So remember, with the heat, you're gonna increase tissue extensibility, allow all those tissues to kind of slide and glide well. You don't wanna ice it because it's gonna just make the tissues more matted down. So a couple of things with a ball. You can use a lacrosse ball or a tennis ball and kind of put it on the soft tissues of the front of the leg, anterior and posterior tibialis, and just roll up and down. You'll feel some adhesions and tightnesses. That's a good one. If you do CrossFit, this is pretty familiar in most gyms. It's a mobility band. What you can do is wrap the mobility band around the soft tissues of the lower leg and do some tissue works, because remember that the lower leg has many compartments, so you don't want to just think linear up and down the muscles. You want to think also rotational, so this is a great tool to be able to do that. And then lastly, I would say doing an anterior tib stretch where you're here putting your hands on the heels and then leaning way back to get a nice stretch through the front of the ankle and the shin. So work on those for me. If it still doesn't improve, you need to see a physical therapist or a movement practitioner.